طيب، بسم الله الرحمن الرحيم، والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وصحبه أجمعين. رمضان كريم ونحييكم ونتمنى لكم يعني تصوموا وتفطروا على كل خير. Good afternoon to everyone who is watching us from Sudan and outside Sudan across the whole world. We are very pleased, I'm Alam Ahmed, to be here in the UNICEF office or UNICEF house in central London. And we're also very pleased to meet the Sudan country representative from UNICEF, Mr. ABDULLAH FADIL. Thank you very much for giving us this valuable time of your very short visit to London. This meeting is very short and it came with a kind invitation from UNICEF to come and meet Mr. ABDULLAH FADIL, who is visiting the UK and other European countries in a tour. He will tell us shortly about what his tour is about. But because of the sake of the time, I will give Mr. ABDULLAH FADIL, first of all, thank you very much. There's lots of viewers watching us now from Sudan, outside Sudan, in the UK, in Europe, in Middle East, in America. And we have the questions here with you. We have received the invitation from your kind colleagues here. So can you first introduce yourself, and I'm sure you know it's Ramadan now in Sudan, and tell people what exactly you have been doing in the last 11 months and where is the role and responsibility of what exactly UNICEF is doing in Sudan.
Thank you very much. Ramadan Kareem, كل سنة طيبين، تصوموا وتفطروا بالسلام إن شاء الله. I think it's important first to put into context the relationship of UNICEF with Sudan. UNICEF has been active in Sudan since 1952, even before independence. The first programs of UNICEF in Sudan started since then, almost 65 years. UNICEF office, as a physical office, has been in Sudan over 40 years. So the relationship with UNICEF and Sudan is quite long. UNICEF, of course, as in almost all other countries in the world, works on issues related to education. It works on issues related to health, works on issues related to nutrition, issues related to water and sanitation, and of course issues related to child protection and child rights. Ultimately, UNICEF is a child rights organization, and rights involve education, health, nutrition, and water, access to water and sanitation. We are actually preparing our country program for the next 4 years, from 2018 to 2021. And in that country program, we're focusing on four main areas. Number one, what we call child survival and development, looking into issues of health, nutrition, and access to water and sanitation of children and families, mothers particularly. We're also looking at learning of children, learning and development, education, access for children, and quality education. We're also looking at child protection issues, issues related to child rights, from stopping children to be recruited into the army, to stopping children, girls to be married off at a young age, or for that matter, what we call in Sudan العادات الضارة ومن ضمنها الختان البنات أو FGM or FGC as we call them. So all these issues are things that we work on. Actually, on Wednesday, we launched the humanitarian response plan for Sudan, of which UNICEF has about $100 million.
Where are you launching this?
In Sudan. We launched it in Sudan with the humanitarian commissioner of Sudan. The UN and the international and national NGOs are requesting about $804 million for humanitarian response to the needs of Sudan for 2017. Of this, about $100 million is UNICEF's ask, what UNICEF is requesting. So far, we've received about 15%, not more. UNICEF, of course, works closely with the government of Sudan. The line ministries, Ministry of Health, Ministry of Education, Ministry of Social Services and Social Welfare. These are the kind of...
Abdullah, if I interrupt you here,
yes.
So we can also, I will let you finish what you're doing in Sudan. In terms of how do you work with the government? Where do you stop? Where do you, how can you tell people? Because this has been a key question, but I will let you come back to what you're doing.
I think it's
how the relationship normally should work according to your mandate?
Yeah. I think it's important to know, UNICEF supports government as well as communities. We're not replacing governments. I mean, we do not replace the Minister of Health, Minister of Education. That's the responsibility of the government of Sudan. But we support in terms of resources, in terms of capacities, in terms of know-how, and in terms of, as I said, sometimes support directly to communities. We work with the government, we work with the international NGOs, as well as national NGOs and community-based organizations. So our role is in support of the government, but also in support of communities and citizens in Sudan.
Okay. So you can carry on. So you're launching, or this is on Wednesday, and you can continue, yes.
Yes, and we are asking, actually, as I said, about $800 million, and of which 100 million is for UNICEF programs. This is the humanitarian side of our program. Okay. We also have a development side, long-term activities which are long-term. The same issues in education, in nutrition, addressing long-term requirements and needs. If I may say, what are the critical issues for the $100 million we're asking for 2017? Sudan, for this year particularly, is facing 3 major issues. Okay. Number 1, South Sudanese refugees. Since the beginning of the year, we've had almost 150,000 South Sudanese refugees arrive.
And if I interrupt you again, your role, Mr. Abdullah, is for both Sudan and South Sudan?
No, my role is actually only for Sudan.
Yes.
And things that are happening within the boundaries of Sudan.
Okay.
So South Sudanese refugees, once they come into Sudan, of course, then they become the collective responsibility.
And is UNICEF got someone for South Sudan?
UNICEF has the representation in South Sudan.
Okay.
A whole country office that's working. We're actually collaborating, but as you know, people cross borders.
Yes.
And also diseases cross borders as well as other things.
Okay.
Yes. So number 1 is the South Sudanese refugees and the response. Yes. Of course, we have also the United Nations Agency for Refugees, yes. High Commission for Refugees, that is actually has the responsibility for refugees in general. Okay. But all the other UN agencies and international partners and national partners are helping, okay. Including the Sudanese Red Crescent, okay. As well as the government of Sudan. So that's the number 1 issue at the moment, because tens of thousands of people have come. Yes. They're coming to a number of states in Sudan, so we need to help them settle and support them for their basic needs. Number 2, Sudan has been facing, last year as well as this year, acute water diarrhea, or what is called Ishal Miyah al-Had. There has not been a declaration by the government of Sudan, yes. So therefore we cannot say it's cholera yet, because we have no confirmation, and it's only the government of Sudan that can declare it under its responsibility.
Mr. Abdullah, can I just stop you here again to interrupt you, because I'm quite keen. This question is being asked repeatedly, and in the news, and every Sudanese dialogue is going. So, because there's couple of things. For example, some people, they're arguing in lots of social media. For example, in the US government, they even having some declaration for their citizens not to travel to Sudan because of cholera, they call it. And the government, as you just have said, they not declared it as cholera. Now, officially, you only go with what the government of Sudan declaring. Is that correct?
Well, health laws require, yes. Governments to declare. It's not agencies of the UN or, yes. Anyone else declare.
So that's to clarify for people.
But I think what is important also is cholera. If it were the case, there's no ban of cholera to travel to countries. I mean, Yemen has declared cholera, South Sudan has declared cholera, but there is no travel ban. So the idea that the country has a cholera and you ban does not exist, and there's no health reasons.
But how do you deal with it? If, for example, you are in Sudan and the government of Sudan is not declaring it as cholera, how your staff, your policy, how you deal with it? Are you dealing with it as, like you said, is halat, or you deal with it as cholera?
Well, first of all, I don't think it matters calling things or labeling them.
Okay.
There are results we're talking about. There has been a number of people affected, almost 9,000 people since the beginning of the year. It impacted 8 states out of 18 states in Sudan. So the idea of calling it, again, also cholera is a technical term.
Yes.
You have to be able to do analysis, laboratory analysis, and have evidence that actually this is cholera. Yes. Neither the World Health Organization nor UNICEF has done those tests. It's the government of Sudan who will do it.
And
so I think it will not be wise to say it's one thing or the other. I think it's important to respond so that people are not dying. And so for us, our focus is to respond and assist the government so that cholera comes from, in the case of Sudan, it has not declared cholera, but if there's cholera or acute water diarrhea, usually the source are lack of proper sanitation, proper water. So in the case of Sudan, we have acute water diarrhea. We had last year and we have this year. We're responding by addressing getting chlorination of water, improved water access to people in need, as well as sometimes when required, vaccinating people. Also awareness campaigns, people washing their hands with soap, people boiling water. So these are the kind of activities we are undertaking at the moment, along with World Health Organization.
This is across Sudan?
Well, across the areas that are impacted. Our focus now is the areas impacted. And the government also, to be fair to the government, has mobilized. Actually, last week they have called us and requested for us to procure on their behalf large, what is called Oxfam tanks, almost 50 of them, so that they can respond and install them in White Nile State and in other states that need them. So the government actually, at the highest level, including the Vice President, has actually called UNICEF and asked help. And so we are actually doing that as we speak.
So you are recruiting this for them?
On behalf of the government.
And the government is paying for that cost?
The government is paying that cost, and actually they asked us to do it. So we are actually, and again, by the way, we also advocate with the government to be more transparent. Excellent. At Ministry of Health, to share the information with the public so that people are not doubtful. Is this cholera? Is it AWD? So that it's not politicized. This is a technical health issue. It's a public health issue. Exactly. South Sudanese actually are coming from areas impacted by cholera. So we want to make sure the best way to address these issues are transparency, full information, and that's what we ask the government to do. But to jump and label things is not necessarily the best way to pursue this. Okay, so I will let you continue again, but for this interruption, for the sake of avoiding many questions, I know you have. So yes, the second one is acute water diarrhea. So that is the other. And finally, if you recall, since last April, there were unilateral ceasefires between the government of Sudan and the rebels or armed movements that it was fighting. In the case of Nuba Mountains and Blue Nile, as well as in the case of Darfur, the last conflict was last April, when there were a number of displacements. Since then, until just about 2 weeks ago, there were no armed conflict between government and armed movements.
For how long do you?
For the last 1 year. As the result, we got more access to areas that in the past we had no access to. Part of that is also Jabal Marra area. So there are more areas now we are able to access. So are you, sorry to, I keep to because this is a very contested topic in all the media. So you have access to Jabal Marra now? We have a lot more places of access in Jabal Marra, including Golo, Rokoro, Drebat. And who protect you when you go there? The government? Actually, in some cases it's the actually UNAMID mission. And in some cases actually it's the government of Sudan, where they are present. But the point is, because I'm sure your experience, you and seniors, the government is being continuously accused of not allowing access, and even in the Congress there was a statement by not giving access to aid agencies and people like yourself. But now you have access to this Jabal Marra. Well, let me finish this thought and then I will share about the access. So as a result of this access, for instance, Jabal Marra, we've discovered that the number of children who are malnourished, and actually to the point of also some of them having edema. So we are responding to that because there's a requirement to respond to that. So if I prioritize what are the 3 critical areas for this year, is the refugees, South Sudanese refugees, is responding to the acute water diarrhea, and responding to Jabal Marra, especially malnutrition issues, but also Jabal Marra in general. Now talking about the access. As you're also aware, the US and the Sudanese government have been in discussion about rapprochement, as well as sanctions being lifted. As part of that lifting of sanctions, there are a number of conditions, including 5 different areas, but the 5th track is humanitarian access. I'm happy to say, since beginning of the year, but also since actually starting end of last year, we've had more access to many areas that we have not had access before. So we are actually able to go to places where people have not been getting assistance. Where else apart from Jabal Marra? Where else? Well, we also have more access to Blue Nile. For instance, we are going to areas that we have not had access to before. In southern Kordofan, we have more access than before. Again, access is not still 100% and it's not full. But you have more access. We have more access than we have had before. We're getting more visas than before. We're getting more ability to go to places. But still, we can do more. That's number 1. Number 2, there are areas also controlled by the armed movements we have not had access to.
Okay.
In the Nuba Mountains and Blue Nile. We have not been able to go to these places for almost 6 years.
6 years?
Almost 6 years in some places.
And they are under the armed forces control.
The armed movement.
Armed movement, sorry.
Yeah. By the way, it's also true for some areas of Jabal Marra. I mean, we still haven't had access for a long time. Yeah. So access has improved, but still a lot more needs to be done.
And are you in any way in negotiation or in talk? I mean, now you have an easy talk with the government. Do you have any access to these people, the armed movements or all this conflict, or that's not part of your role really?
No, actually, anything that happens in Sudan is part of our mandate.
Okay.
No, we signed what do we call an action plan to stop recruitment of children, for instance, with the government of Sudan last March, last year. So we're engaged with the government even on this issue. But at the same time, we also signed an action plan with SPLM North last November in Geneva, also for them to work on the issue of not using children for armed conflict. Okay. We also do the same thing with GEM and SLM Minawi. So all of the movements, we've been in touch with them, we do workshops with them, and we meet with them on a regular basis outside of Sudan.
And they are responding? Okay.
They are responding, we are also always encouraging them to provide the access for humanitarian access to reach the people in need, but also issues related to recruitment of children, because we don't want children to be used
we had many questions like this
for anything but children should be given the opportunity to be educated, to have life as children and not as soldiers or used for acts of war.
So these three key areas, they are the key issues you're going to address in your strategy for the next 4 years.
Well, no, this is actually what we're responding to this year. But
this year forthcoming.
For this year, 2017, these are the issues we're dealing with. But for our strategy, the 4-year strategy is to address issues related to child survival and development, so that children are not dying in Sudan. Infant mortality in Sudan and child mortality is still quite high. We want to address that. We want to make sure that 2 million children are malnourished in Sudan. 500,000 are stunted in Sudan. We want to make sure that this is not the case. So children, when they are growing, they have healthy growth in their brains. When they're educated, they can respond and develop fully. So this is one area we're working on. As you know, Sudan, there is no proper access to water and sanitation.
Yes, and that's one of the questions being asked regularly about.
I mean, Sudan is a big country. 2/3 of the people don't have, water coming to their homes. There's no flushing toilets or even toilets that actually open defecation, for instance, in Sudan. No state is open defecation free in Sudan.
Can I ask again, this figure of 2/3 of people, of this all Sudanese people, they don't have access to water in their houses. Where is that figure from?
This is the actually Minister of Health and Statistics Department, together with agencies of the UN, what we call the mixed survey.
Excellent.
And it's public document with the government of Sudan. Indicates when we did the assessment that either people have drinking water that's acceptable, or water that comes to the homes, but water piping in the homes in Sudan is no more than 1/3 of the people in Sudan.
Okay.
Direct water pipe connected to toilets and family homes and kitchens. So people still fetch water and walk to get water in their, particularly in the rural areas. Right. So this is actually a fact. Sudan is a big country. The infrastructure is not there. And because the country has been unfortunately engaged in survival mode because of conflict, the investments were not taking place during that time.
Okay. One question, because this is being echoed by many people, even in the diaspora, when you contacted us about the diaspora, when you have identified these three criteria, these priority areas, and you're going to focus on them next year, have you involved any expert or any Sudanese diaspora, or any think tanks, or any universities, or any, whom was involved in I know clearly they are the criteria, they are priority areas, but who is being involved in, because one of the criticism, even yesterday I had an interview regarding the Millennium Sustainable Development Goals, and one of the critique for United Nations targets and goals is that most of the time they are not actually involving the people on the ground, agencies, about in putting this target. So who was involved in very brief?
Well, I can tell you this.
Civil servant
I can tell you this. As I said, we have partners. For instance, we have partnerships with FADIL University.
Okay.
We have partnerships with Khartoum University. Statistics Bureau and Population Bureau of Sudan, line ministries and their different departments of planning.
Excellent.
But also sometimes national NGOs are our counterparts for doing some of these statistics. Recently, we finished actually a study on costs, what it costs to send children to school in Sudan. Some of the people who did this were actually Sudanese economic professors and doctors.
Excellent.
So we are actually engaged with the local people. And actually the reason we wanted to have this meeting with the diaspora is we actually want to encourage diaspora to take more responsibility and actually to support the development of work of UNICEF and other agencies of the UN, but also communities and civil society. Because Sudanese, historically, Sudan has always had an excellent education. Those who graduated from, the famous Khartoum University in the past, and so we want to tap into that. And unfortunately, Sudan has not had a good outcome for its educational development of graduates of late, but still, Sudan still today produces about 7,000 medical doctors a year.
Yes.
So still, Sudan has a lot of positive things ongoing.
Are you aware of a recent decree by the Prime Minister, I think less than a month or so, in which he established a council for experts and Sudanese experts living abroad?
Yes.
Are you aware of that?
Yes, I'm aware of that.
What do you think of this movement?
Actually, some of my friends actually came back to Sudan for that period. I remember it was about a month and a half ago.
Yes, a month and a half ago.
Actually, it's excellent. I mean, when you have so much Sudanese talent all around the world, in the Gulf, in London, for instance, in the UK, elsewhere, in the United States, to be able to tap into that and actually get them to come back and contribute is important. But also for them to do that, the systems have to be in place. So this is where we're actually helping on advocating with the government to have the systems in place so that the talent that Sudan has can come and contribute. So when the first Vice President, Prime Minister did this, we were actually happy, and we hope this leads to actually much more engagement with the diaspora.
Excellent. One of the question before I go on this one, some people, they still get confused about what is the role of UNICEF. I know you did explain that. Because from even your name, United Nations International Children Emergency Fund, that word fund, the emergency fund. So some people, they see you as a funding organization, some people, they see you as a transformation. So where is the word funding? Are you a funding organization? Because some people, they expect you to solve all the problems. Sudan is a poor country. It's a country really needs a lot. So because some people got that sometimes mixed.
I think it's important to note UNICEF was created as a result of the Second World War. UNICEF actually initially responded to the crisis of Europe. UNICEF actually was helping a number of European countries at the end of the Second World War, including Germany and others, to help them come out. It was an emergency fund, not funding, emergency fund to respond to issues related to education, the same things we do now. Since then, the name remained, but UNICEF actually is an intergovernmental organization. Sudan actually is joining next year, 2018, to become member of the board of directors of UNICEF. So member states actually guide and direct and decide the funding as well as the vision of UNICEF. So it's actually an intergovernmental organization. We're not a funding...
because that's where people get sometimes
we're not a funding... Yes, we do provide support to address critical emergency, as I indicated, South Sudanese refugees, AWD, and we have to respond to these things. But we're also a development organization. We invest in long-term issues, including sustainable development goals. Education, because education is a life-building exercise. That's a long-term investment. Malnutrition, addressing malnutrition is a long-term investment. Child rights and changing behavior and norms so that girls are not married off early. There's an economic consequence. Girls are not, cut. Is also a long-term investment. So these are the kind of things we do also for long-term, not only for short-term.
Excellent. Now, before we move from, let me just get, maybe if we can finish this quickly, the diaspora one, because you have just showed your UNICEF interest, and also you said you support this idea of the diaspora. We have, for example, I just go through them very quickly. For example, we got Dr. Nadim, who is a consultant on child development. He's a UK Sudanese UN national, but he's in Qatar now. He said you have a great golden opportunity to help Sudan. He mentioned it in the WhatsApp message. He said there's 4 issues. Number one, he said you have loss of credibility in what you have done before. He said he have heard about your work. Secondly, he said most of these child development centers in the Gulf states are led by Sudanese consultants who are actually British. It's just now working in the Gulf. And he said they are very happy to take you around or to take UNESCO to show them the lessons learned from these centers. And they also said they are also happy to come and help in the training and to get in touch with you. But most importantly, they mentioned, which is AHFAD, you mentioned AHFAD now twice. They said from their experience as consultants in child development, universities like Nilan, AHFAD, and other universities, they do produce good psychology students. So they are willing to be engaged with you. And I tell you another one called Professor Ibrahim Bani he's a consultant community medicine. He said, there's lots of questions. I think you addressed most of them, but he said, I developed a nutrition supplement to be added directly to meals or drinks for children, women under conflict, refugees, and displaced population. This was in Darfur with support of the Micronutrient Initiative in 2008. He's quite famous, this guy. The project was presented in international meeting. I can send the details. I'm looking forward for support this project, which I can be of great implication. So there are already people coming forward and we can get you in touch with all these people. They're quite, but if I can just take you to some of the questions which have been asked. What exactly, in summary, your role in this crisis now in Sudan, cholera? Where exactly, what are you doing in terms of the cholera itself? Or whatever you call it, ishalat, whatever. Because this question is being echoed. What is the role of UNICEF is playing in this? Well, what can you do, or what are you doing?
Let me address first the professor and the doctor, and let me actually invite them to get in touch with us. We need their help. We need their assistance, whether it's coming to Sudan or our teams, technical teams, to go into. And we will
make sure we will get you all in touch with him, definitely.
Absolutely, they're invited to come and help us and do whatever it takes. We need Sudanese talent because children of Sudan, we don't care about children of Sudan more than the Sudanese themselves.
Yes,
so I think it's important, every Sudanese, government, civil society, to contribute to this. Over the last decades, most of the support comes from the outside. I think Sudanese are generous by their nature. They do give to their communities, but I think when we do it together, the impact will be much more. Again, as I said, the acute water diarrhea, because we need to use the technical term until such time that otherwise is declared, is a critical issue. That's why for us is the second issue we're dealing with this year. As I said, we are working together, all of the partners, including the government, and I'm sure the same way we were able to respond last year and stem so that no one dies from this issue. We really need to have more concerted effort. We need more transparency, and we need the support of everyone who can support. And so part of our discussion now is actually to raise awareness and also raise funding that we need to respond to this.
And this funding will be from outside, from...
Well, I mean, the donors who have always been generous with us, as well as I said, the Sudanese government committed to buy now this 50 Oxfam tanks with their technology.
And would it make any difference? I mean, you said earlier it doesn't make a big difference, but would it make any difference to what you're doing now regarding this, whatever you call it, technical term, cholera or not cholera? Would it make any difference if it's being declared cholera or not cholera now? In terms of what you're doing at UNICEF?
Well, from our perspective, not really to one extent, because for us, we don't want any child or a person to die. So we will respond no matter what, whatever it's called. But I can tell you this, that some of the donors, if it's declared, because their systems are such that declaration of a waba or epidemic, they are able to fund more quickly and actually more readily. So that puts sometimes limitation on the funding you receive. That's the only negative side I see. But it didn't stop us last year from responding and actually being able to address it. And certainly it doesn't stop us now. But again, that's a technical term, and I leave it to the government and WHO to determine. But for us as UNICEF, our role is clear, is awareness raising, is about the water part, which is critical to acute water diarrhea, and we're responding to those. Okay,
from all what you mentioned, there are quite key areas, but what about education? Because you mentioned them, but in the key areas now you mentioned, I know if you solve this one, you will be able to get engaged with education better. But there is this figure is being quoted from UNICEF report 2015. There are 3 million children under 15 out of school in Darfur. Are you aware of that figure, or do you think?
Well, actually, it's not 3 million out of it's not in Darfur.
Yeah.
It's the entire Sudan.
So entire, because this is just from someone
not,
asking. Yeah.
I mean, it's actually, this is figures from not from UNICEF. It's from actually the government Ministry of Education of Sudan.
Okay, because it just came from one of the questions.
It's actually Ministry of Education. 3.1 million children are out of school, and UNICEF actually is working towards how to get these children back in school. Not only in school, but quality education and quality schooling. Sudan has actually the largest out-of-school children in the Middle East, North Africa region.
The largest?
Largest.
So Sudan is with the largest children out of school in the whole Middle East and North Africa region?
Yes. 3.1 million children, at least. And actually, if you take even to the age of 18, it may have actually reached 3.8 million. Yes. So UNICEF's programs.
But can I ask you, just because I know we're running out of time, particularly Sudan, you know, in Rabi' al-Arabi and all these things happening in Libya, Tunisia, and all this, some other, Egypt, for example, Sudan has not been prone to that huge conflict. I know we have Darfur, we have the Sudan, and why we have the largest number of kids out of school in the Arab region? We can finish with that question.
Actually, you know, people talk about Syria, and rightfully so.
Yes.
Syria has, you know, the catastrophe that happened in Syria did not happen anywhere else. Yet Syrians were able to remain in schools because I think refugees also in the countries, neighboring countries of Syria, have been able to have access to education in those countries, thanks to the support by the international community. In the case of Sudan, the reason that many children are out of school is varied. One has to do because the center versus periphery. I mean, in urban areas, more children go to school, rather than in the rural areas. Number two, education in Sudan is expensive. Even free education, parents also contribute because the government invests about, I would say, even though it increased, the government actually increased over the last 3 years, the public expenditure of education. It actually has gone up.
Yes.
But because of inflation and other reasons, that's not enough. Government funding actually mostly goes to recurring costs, teachers' salaries.
Okay.
But the need actually is quite high. So social norms is another reason. There are some communities in the east of Sudan, for instance, that do not send their girls to school.
Yes. We have all these questions, yes.
That's another problem.
Okay.
So there are a number of reasons. You know, wealth, economy has one to do, social norms has another to do, conflict areas. Most children out of school actually are in conflict-related areas. So there are not schools. For instance, in the some of the Nuba Mountains and Blue Nile areas, because there's a conflict, schools will stop. But there's also a positive side. In, for instance, IDP camps, still the UN, the government, and international partners have created schools. And actually, I was happy, and maybe this we could end with this. Last Wednesday, actually, I met with someone actually who comes from Abu Shok IDP camp.
Okay.
He went to the IDP camp when he was about 12 years old. This is 2003, 2004. Today, he graduated from medical school, Khartoum University. He's just come up with an invention of a smart stick for blind people. He's been invited to present his innovation in Canada and other places. He wants to go to do his master's in medical engineering. So someone who's displaced goes to an IDP camp, yet finds the opportunities because of the support of UNICEF and others like us. So I think, and again, Sudan, as I said, has a history of, people actually always ask, before even food, they want education for their children because they realize that's important.
Because it's alarming now, we are, yes.
So that's why for us it's important to work hard to make sure that every child has an opportunity to go back to school. And I think one of the main issues that actually we're raising are how to get as many girls and boys. And I say girls twice because in universities now more girls are there than in boys.
Yes.
So we want to make sure girls are also having the biggest chance to be able to go back to school and contribute to the economy of the country.
Okay. Thank you very much, Mr. Abdullah. And I'm sure you all accept our apology here because there's lots of issues. I mean, we are here in the UNICEF office and you can see Dan and all other people here working. It's quite, we are very grateful actually for them giving us even this almost 1 hour now. But we were going to talk to Mr. Abdullah and his colleagues about how we communicate all what you have sent to us, plus most importantly, how we can get him in touch. We will need to have it in a proper way, which they prefer it, in order to get all these consultants, all these experts, because I can see on the list in front of me lots of people, experts in child development, public health, nutrition, community. So definitely we will find the way they want it to go forward, but the important thing, you can see the message, they are really looking for us to come and help. They are looking for us to provide our advice, our any kind of generosity. He already said Sudanese are famous for. And thank you very much. Thank you very much. We really appreciate your time. Thank you, Dan, and thank you all of you. Thank you very much.